Okay, so we are to quickly talk about bone marrow fibrosis. So bone marrow fibrosis is what is commonly known on the street as myelofibrosis, or is myelofibrosis not the technical name for it? I think myelofibrosis is a technical name for it, while bone marrow fibrosis is like the normal one we can actually call. So this condition just have to do with see a film with like a healthy bone, while you see a film with myelofibrosis. There's fewer red blood cells, okay, white blood cells are more, okay, platelets are just there, then the extracellular matrix is actually modified. So modified extracellular matrix, so unhealthy fibrous bones produce fibrous or scar tissues. So you see fibrous and a lot of scar tissues in this type of bones. Alright. So bone marrow fibrosis is also known as what myelofibrosis. It's a rare blood cancer where excessive scar tissue forms in the bone marrow. Okay, so this will now disrupt the normal production of red blood cells, leading to various complications and symptoms. You understand? So mutations, these three genes are the ones that are usually implicated in bone marrow fibrosis. Okay, MPL gene, the CALR gene, the JAK2 gene. Alright. So primary myelofibrosis occurs on its own without any prior bone marrow disorders. But secondary one is usually like from one blood disorder to the secondary one. You get? So symptoms is the individual will be weak, there'll be pain, okay, because of enlarged spleen, there's easy bruising and bleeding, there's night sweat and fever, there's bone pain, okay, due to the expansion of the bone marrow. So you see this is another fibrotic bone marrow. If you want to define a fibrotic bone marrow, you say that what red blood cells are reduced, white blood cells are much. Okay, then there's formation of what fibrotic tissues in between. Right, you do like that. So diagnosis is blood test, bone marrow biopsy, because you want to confirm fibrosis and presence of some abnormal cells in the bone. Genetic testing, where you want to now identify specific mutations. Okay, then treatment is use medications like JAK inhibitors just to reduce the symptoms and slow the disease. Blood transfusion just to manage anemia. Spleen removal, total removal of the spleen. Then bone marrow transplant. This is basically considered for patients that are much more younger. Alright. So prognosis, if it's a chronic condition, it's a chronic condition, you understand? So it progresses slowly, right? So you can now what lower the quality of your immune system. When it lowers the quality of your immune system, it now predisposes you to having any other common infections that might come around. Okay, so that's just it for myelofibrosis, also known as what bone marrow fibrosis.